So,
Well, that's just it. We have to change our thinking when we have a tool that can augment what the body's trying to do. So there's a lot to unpack there on that story, Jeff. So I'll try to hit on a couple of points. First, when we treat someone and have a positive response, we treat an arthritic knee that may be hurting for 10 years and all of a sudden it's not. We have a rehab problem still to address.
100%.
We're not done. And that gets back to your point. If you use ACL injury as an example, after ACL injury and repair, the vastus medialis muscle, the inside muscle of the quad, shuts off. And we have a hell of a time getting it to turn back on, even though the ACL has been repaired. It's a negative feedback loop. And those things are going on within our bodies all the time. So that's point one. With regards to getting to problems early, I wish we could get to problems sooner. I get them at the end.
Right.
And that's partly a cultural issue of the medical community and patients. I'm not that bad, so I'm not going to go to the doctor.
Exactly.
Right. So there's two premises with regenerative medicine I think are applicable to your story. The first is when we can work with an acute injury to enhance the healing process. That's always better. Right. So the body's always going to try to heal. But what tissues do we work with in orthopedics? Avascular tissues that have a crappy blood supply. So they're lousy healers to begin with. So just waiting, you may improve, but that doesn't mean the process has gone back to normal.
That's right.
And that sets up a degenerative cascade that continues. And that's why we all deteriorate. So if we could intervene early in that process and take a problem that may not complete healing and get it to complete that process with help, that would be huge, right? That would be incredible. I rarely get that opportunity, right? I'm always getting them at the end.
That's right.
So that's healing augmentation versus chronic management of a chronic problem that we cannot reverse. So your point is very spot on. If we can get to problems sooner, it gives us a much greater opportunity to change the course of a disease process as opposed to just managing it. Very, very big in my world.
Yeah. And that's what I realized because, I work out every day. I do something, lots of things. And I'm on the road to recovery, but I realized just what a big hole I fell into. Right. And so if you're listening to this and you've got an injury or you have one in the future, God forbid, but if something happens, if you're going to be active, something's going to happen. Jump on it would be the take home message, and realize that utilizing some of these regenerative technologies can be amazing, particularly if you get to it early. Right. Think about that.
And you mentioned another really important topic, I think, that we're very excited about. And I was happy to talk with you today about this. And that is the convergence of kind of longevity medicine and regenerative medicine. There are so many synergies and parallels, as you know, but you described my nightmare. What's my nightmare? You did 5 different things at the same time and you got better, which is fantastic. Yeah. But in my role, I have to try to figure out how things work so I can make them better.
Sure.
And when physicians do HA plus cells plus PRP plus something else plus peptides, I've got to try to unwind that process to see what actually worked. And it's kind of kitchen sink versus if this field has a future, we have to understand the processes that create the effect. So I've got to approach it from a little bit different perspective. And perhaps we're simplistic to a fault. For example, apply PRP and see if it works. That's one intervention. That doesn't mean it's perfect nor best, but my job is to try to understand those mechanisms to predict an outcome. Yeah. Everyone asks me, when is insurance going to cover this? What's never going to cover it until we can predict its behavior.
Sure.
Because if you can't predict its behavior, you can't translate that into cost savings that a third-party payer might be interested in.
Right.
And that's a lot of our work, is trying to create predictive models. So you come in and we say, all right, you're a 75-year-old with this medical history and this problem. And based on 10,000 patients' data, we need to make that biologic to give you an 82.3% chance of 50% improvement lasting 3 years, right? That's the thought process of where we need to go.
Yeah. And I get the thought process, and I applaud you for the work you're doing, because I think too many times we don't actually fully understand what we're doing, right? And yet, in our world of longevity medicine, where we want to get the best for our clients, we've tried a thing by itself. We've tried another thing by itself. So we know what peptides alone can do. They can be amazing in certain situations. We know what PRP can do. It can be great in certain situations. We know what some of these other things can do as well. And it brought us to the point, though, where they're not getting us all the way there. Mm-hmm. And so when you're not getting all the way there, then you start to think about, well, what would be an intelligent way to stack these together?
Yeah.
Right. If you start to understand them. And so the concept of creating kind of the informed, or what we might call intelligent, or somewhat intuitive, or maybe it's just pure luck, I don't know, but stack of putting these things together because the client wants to get better, right? And so they don't want an 82.3% chance. They want a 100% chance, or a 99.9. So that's kind of where that's evolved from. But I think, to your point, being a little bit more reductionist in the thought process to actually get to what is the underlying mechanism, how this works, it doesn't preclude you in the future of saying, okay, now we understand this. What happens if we add this to that?
Of course.
Now where do we go, right?
That's the crawl, walk, run, right? That's the crawl, walk, run.
Yeah,
exactly. And also, in terms of longevity pathways, it creates the potential for prehab, right?
That's right.
Optimization prior to treatment. So if someone, like, let's use the epigenome as an example. Let's say we were able to run, genomics and identify that someone has a really suboptimal epigenome, or glycation profile, or any number of things, telomere length, whatever it might be. Well, a lot of that, not all, but some is modifiable, especially epigenome, right? Telomere length. That's modifiable. So maybe before we invest in an expensive cell therapy, we might want to do some work, for weeks to months beforehand, try to improve that. That should translate into an improved therapeutic capacity of our cells. Now, we're studying that. It's going to take a lot of data to prove that out, but theoretically, it makes perfect sense.
Right.
And we should be pursuing that stuff aggressively.
I think so too. I think the other thing that my own situation really kind of drove home for me is that there's a ticking clock. So we're trying to get it right, but we're also racing against the clock, because the clock, the longer we wait, the more collateral damage there is to the actual injury, right? Whether with nervous system and the muscle atrophy and the bone atrophy and the way that tendons work, and all of that stuff is going downhill. So from my perspective, there's kind of this ticking clock. And what we're trying to do is intervene as quickly as possible, so there's as little decline and as much restoration as possible. And I think in what you're doing, being able to understand the mechanisms, you're going to be able to figure out how to do that, is kind of what I'm thinking.